Welcome to She Persisted. I'm your host, Sadie Sutton, a 19-year-old from the Bay Area studying psychology at the University of Pennsylvania. She Persisted is the teen mental health podcast made for teenagers by a teen. In each episode, I'll bring you authentic, accessible, and relatable conversations about every aspect of mental wellness. You can expect evidence-based teen-approved resources, coping skills, including lots of DBT, insights, and education in each piece of content you consume. She Persisted offers you a safe space to feel validated and understood in your struggle, while encouraging you to take ownership of your journey and build your life worth living. So let's dive in. This week on She Persisted.
Sometimes people find it very helpful to have a clear diagnosis, and sometimes people are able to say, well, who cares whether or not I have it or whether or not I have a diagnosis? Let's just figure out how to make me better at focusing and more effective. And I would say certainly for anyone out there that whether or not you have ADHD, if you are having problems with your performance in school or professionally, then the things that we're going to talk about today will be helpful for you.
Hello, and welcome back to another episode. I don't have my normal microphone today, so sorry if it doesn't sound as crisp and clear, but we have a great episode that was recorded with the correct microphone. We have Dr. Nick Nissen on the podcast today. He is a Harvard-trained psychiatrist, researcher, and expert in ADHD, and we talk about all the skills that you can use to navigate ADHD, like lifestyle changes, supplements, medication, executive functioning skills, therapy, and different technological shifts you can make to really get to the root cause. And a lot of what we talk about in this episode is treating and coping with ADHD without stimulants. I know you guys always love the ADHD episodes, and this one does not disappoint. So without further ado, let's dive into this episode. Thank you so much for joining me on She Persisted. I'm so excited to have you here. Episodes about ADHD people always love and have so many questions about, and it's definitely a topic that people are becoming more and more aware and curious about. And so I'm really excited to get your thoughts on all things not taking a medication approach, what changes people can make in their lifestyle, and then also your background and career. So thank you for coming on She Persisted.
Absolutely. Thank you for having me.
Of course. Okay, so for people that are not familiar with your background or your career, can you explain how you got into specializing in this specific area and becoming an expert in ADHD?
Absolutely. So I'm Dr. Nissen. I'm a psychiatrist, and my training, I guess I went through formal medical training, sort of the first part of becoming a psychiatrist. So I did undergraduate at the University of Notre Dame, medical school at Brown University, and then psychiatry training at Harvard Medical School. And it was really at Brown that I started to really fall in love with psychiatry. I'd always thought that I wanted to be a surgeon and do cleft lip and cleft palate repairs because I felt like it was, so terrible to be in a situation where you'd be born, with a condition where in many parts of the world where you would be, bullied or rejected because of it, and really wanted to help with that stigma. And then I did my required psychiatry rotation, and I realized that there's so much stigma in mental illness. And it was something that I had experienced, with friends and loved ones growing up, but I think it really impacted me during my training. So then as, going through my psychiatry training, I was realizing that ADHD was an issue that was on people's minds. As you know, in the last few years during COVID, a lot of people were converted to fully virtual workspaces, fully virtual educational spaces, and they were all feeling scatterbrained. And actually, during the pandemic, the rates of ADHD diagnosis surged, and the rates of prescribing of ADHD medications surged. And I think a lot of people were sort of confused by that and also scared by that. A lot of the medications that are used for ADHD have side effects, and they have concerns associated with them. So, I really felt a need to think of, well, how can I sort of make this clear for patients what ADHD is, and then also what their options are that are available to them so that they don't feel like they are, only given one possible solution, being Adderall. So I wanted to look beyond that.
Can you give us that explanation that you give patients? I think it's very helpful, especially for people that are listening with a sibling or a friend that has ADHD and they're not super familiar with the diagnosis or the implications in school and work and just day-to-day life. So how do you explain that to patients?
Absolutely. So ADHD is a neuropsychiatric disorder, which Means that it's a disorder that has a strong footing in both the hardware and the software of the brain. You could have, and I have had one patient who had a stroke in one specific area in the front of the brain, and he had, wildly severe ADHD as a result of that. So there's definitely a possible physical source to it, but then there's also a behavioral source to it. There's a problem with software, or there's a problem with nature nurture. There's a problem with nurture. There's ways that you can make it worse, and certainly being in situations that don't train you to hold your attention for a long time, like a lot of social media is nowadays, that's a way that's going to train it to be poorer. And so a way that I like to talk about it for people is that it's a problem of both nature and nurture for people. There's a strong genetic backing to people that have ADHD. So there's a genetic risk profile that needs to be considered. If you have parents that have ADHD, if you have siblings that have ADHD, it makes it more likely that you have ADHD. And then there's also varying severities of ADHD. So some people have very mild symptoms and they're able to just kind of figure it out on their own and still do well. And then there's very severe ADHD where you can imagine, where somebody can't even put together a short list of to-dos, or they don't even have a calendar or haven't been able to set up a calendar and remember to check it. Those sorts of people never hold jobs or aren't able to get a career or graduate any classes. So there's a whole range of severity. And then the other thing that I would say is that there's a lot of diagnostic uncertainty out there. Many people think that they have ADHD, but probably, a fraction of those people do actually have ADHD, meaning that it's significant enough to cause impairment in their functioning. And it's something that develops typically in childhood and that has notable impacts across multiple environments as they're growing up. And people can have lapses in their ability to concentrate and focus in depression, for example. So sometimes people have undiagnosed depression, they have difficulty focusing, but they're also relatively sad or low energy, and it turns out it's actually depression and not ADHD. Or maybe they have low thyroid and they feel very very fatigued, or they have anemia and they feel low energy and difficulty with concentration. So that's why it can be important to have an evaluation by a medical doctor or a psychiatrist to really make sure that this is what you have so that you can go about trying to treat it.
You mentioned that a lot of people think they have ADHD, but they don't actually have ADHD. And this is a really big thing on TikTok. There is like a whole adult ADHD movement. And you see so many people being like, I just found out I have ADHD, or like my ADHD brain. And when you look at the data, like the percentage of the population that has ADHD, it doesn't really match up with what we feel like we're kind of seeing on social media. And I think just like all things mental health related, there's a spectrum. Like not all of us are perfect focusers 24/7, and not all of us have severe ADHD. What are your thoughts on that self-diagnosing aspect, and even just like the huge rise of diagnoses? Is it people are just more aware and actually getting diagnosed, or is it you just maybe are not the best at focusing and this is not an ADHD problem?
Yeah, it's a super juicy question, and actually amongst my psychiatrist friends, some of us sort of feel like I need to push back and be like, is ADHD just created by sort of the economy and this drive for like increased productivity, and like should we be more accepting and willing that hey, like we're just kind of dumb people that like kind of do some things right sometimes and are very inefficient other times, and like grow in our acceptance of that. And I think there is something to be said of that humans can strive towards too much sort of robot-like efficiency or perfectionism, and that we should accept a little bit more our dumbness or our lack of efficiency. So that being said, it is extremely difficult in the United States to get evaluated for ADHD. The diagnosis is often made by a child and adolescent psychiatrist, of which there's an enormous scarcity in many parts of the country. It's impossible to see child and adolescent psychiatrists, and of those that are out there, also a lot of them don't accept insurance, and so then there's an issue of accessibility based on economic means. And so they would be one group of clinicians that would be able to do a diagnosis, but another sort of a required standard for people that are getting like academic accommodations, extra time on tests and things like that, is to get a neuropsychological evaluation, which is a several hour long evaluation by a neuropsychologist, which is a subset of clinical psychologists. who charge thousands of dollars for these evaluations. And so again, it's not only are they few and far between, but also, not accessible to everyone. So I think there are a lot of people across the country that maybe really did struggle academically their whole lives, and they didn't have the resources or the means or know anyone around them that could evaluate them for ADHD, or they just didn't know about ADHD. The other thing I would say is that, sometimes people find it very helpful to have a clear diagnosis. And sometimes people are able to say, well, who cares whether or not I have it or whether or not I have a diagnosis? Like, let's just figure out how to make me sort of better at focusing and more effective. And I would say, certainly for anyone out there, that whether or not you have ADHD, if you are having problems with your performance in school or professionally, then the things that we're going to talk about today will be helpful for you. So in many ways, CBT for ADHD, cognitive behavioral therapy for ADHD, or executive function coaching is something that kind of all of us need. A lot of people say it's sort of like, adulting 101, but it's true. So yeah, I guess sort of it's a long-winded answer to your question, but I would say that yes, there are probably people that have undiagnosed ADHD. Yes, there's probably people that are just sort of following the TikTok trend and they think they have it too, but they probably don't. And the main distinction between those groups of people would be whether or not they had these symptoms from an early age and that were consistent across different atmospheres or different scenarios. So these symptoms were present both at school and at home. And then also whether or not you can rule out that they had other things going on. So it definitely wasn't due to depression. It wasn't due to, like I mentioned before, a thyroid issue or anemia or another medical problem like that, sleep apnea also. Yeah, and that it's significant enough to cause impairment across those areas.
Yeah, it's really interesting. I'm excited to dive into all of the behavioral shifts you can make, because when we think about like the context of COVID and how much we're now relying on technology in academic and workplace settings, and how distracting that can be, and also what our interactions with social media look like now versus even 5 years ago. Like, things are much more engaging and at a much faster pace. And so it makes sense that with all of those distractions and with how our attention spans have responded, that maybe it feels harder to focus than it did 5 years ago. Or maybe the environment looks different and you don't necessarily have the skills that transfer over. And so I think that's another piece of the puzzle that I think universally it can be a relatable experience. But before we dive into all the things people can do, I think another really interesting piece of this puzzle is over medication. And there was all the news headlines about Adderall shortages and a bunch of studies that have been done with regard to adolescent prescriptions of stimulants. And so many schools of thoughts here. But what is your perspective on stimulants for ADHD and potentially over prescribing them to kids and young adults?
Yeah, so stimulant medications are typically the treatment for ADHD, both in children and adults. So these would be medications like Adderall, Ritalin. There's a lot of new versions of these medications, Vyvanse, Focalin, Concerta, Adderall XR. There's a lot of these brands out there. And these medications, when you look at the effect size, so how effective and kind of how big of a chunk of people you could expect to improve with these medications, they're amongst the most effective medications that we have in psychiatry and also in medicine generally. The effect sizes comparably are really good. So it really helps to add a stimulant for people that have true ADHD. There are two major sort of classes, and so one is amphetamine based and one is methylphenidate based. Amphetamine based are the Adderall and Adderall type of medications. So Adderall XR, Vyvanse is sort of a relative as well. And then the methylphenidate medications are Ritalin, Concerta, Focalin, and several of these other medications. The amphetamine-based ones increase dopamine and norepinephrine, which are two neurotransmitters. They increase them more in the synapse. So these are kind of like stronger stimulant medications. Adderall is a stronger stimulant medication. Methylphenidate increases dopamine and norepinephrine a little less. So methylphenidate or Ritalin is a little bit of a lighter version of Adderall, even though the outcomes are pretty similar. So there are some significant concerns with these medications. I personally, would definitely think twice about using them for myself or for any loved one or for any of my patients. In fact, I very rarely prescribe them. And that is for a couple different reasons. First of all, these medications are known to have addictive properties. So for this reason, they're Schedule 2, so they're controlled substances, which means that you have to work very closely with your prescriber to get these prescribed to you. And you can't just get one prescription with a million refills and you're all set. You need to check in with them regularly to make sure that you're not having an addiction or a dependency to develop. Also, as part of that, your body can become accustomed to the medication. Tolerance is what it's called, meaning that if you don't take breaks, one weekend or 2 weekend days, to sort of have your system reset, then you're going to keep needing more and more to have the effect. So because they're controlled substances, there's a lot of logistical challenges related to that. You mentioned the shortages. Those are a huge pain in the butt for both patients and for prescribers. Because there's a shortage, I think is first Adderall. Then people had to prescribe other stimulants to sort of replace those. And so then it led to shortages of all other sorts of stimulants. And so then that meant that patients were calling around to all these different pharmacies, trying to see what they had in stock, and pharmacies were overwhelmed. And to some extent, it's still happening right now. It's been going on for over a year and a half now. So that's one thing for people to think about. It's like, do you really want a medication where there's going to be this much headache each month to, get it refilled? The second thing I would say is that there are concerns around physical health. So stimulants are known to increase your cardiovascular measures, so increase your heart rate and your blood pressure. For a long time, it hasn't been known whether or not that has any long-term risks, but there was a recent study that was published by Zhang and colleagues that showed that there was an association between long-term stimulant use and cardiovascular events, heart attack, stroke, things like that. And so certainly, especially in the adult population, well, even in the kid population where you would be taking this for a long period of time, that's something you want to think about. So for any of my patients that I do prescribe stimulants, I say, this really should be a temporary measure until we can get your executive functioning to top notch, and then we can get rid of this stuff. So that's one thing to consider. The other thing is for a long time, there have been animal studies that show that there's maybe some neurotoxicity, some toxicity to neurons, and that there could possibly be some areas of the brain that are damaged by use of stimulants. And that there's other side effects that are worth considering. People, if they were genetically predisposed to psychosis or schizophrenia, for example, stimulants, especially amphetamine-based stimulants like Adderall, could have some risk of triggering psychosis or a manic episode in somebody with bipolar disorder. A genetic predisposition, insomnia is a common side effect and problem. So there's many things that are downsides to these medications, even though, like I mentioned at the beginning, they have good effect sizes and can be very helpful for people.
Yeah. So executive functioning and behavioral shifts that you can make to improve attention and focus and just like general functioning when it comes to completing tasks and staying engaged. Talk to me about what that looks like. Does executive functioning fall under the umbrella of CBT? Are you pulling from different modalities? What do you recommend that patients implement?
Yeah, so there are a few evidence-based, I like to call them psychosocial interventions. These are medication-free interventions that can be helpful for ADHD with randomized controlled trials backing them up. So one is CBT for ADHD. That's cognitive behavioral therapy for ADHD. Another one is executive function coaching. Actually, executive function coaching doesn't have as strong of an evidence base, but I'll talk about some of the similarities here in a little bit. Another one is cognitive remediation or cognitive training. That's done by psychologists. And then the final one that I'd say is mindfulness-based cognitive therapy. So the first three that I mentioned have some similarities and overlaps. These are different forms of psychological support, often delivered by a therapist or a psychiatrist, that are focused around a few different major executive functions. The most common ones would include calendar management. So this is making sure, first of all, that you have a calendar. Second of all, that you're practicing good calendar hygiene. So this is something I check in with people on their appointments is, do you have both formal commitments and informal commitments on your calendar? So you can see, hey, I told somebody I was going to meet with them for lunch at 1 p.m., but then now I see I also have a meeting scheduled for 1 p.m. I signed up to go to this conference on, a month from now, but now I'm just realizing that one of the nights is actually my anniversary, something like that. Does it have built-in transition times? So things like if you have one meeting here and then another one across town, you can't have them back to back. You need to build in your time to get from one to the other. And then having notifications on or a way to know that. And then also an important part of the calendar hygiene is checking at least twice daily. So practicing with people checking in the morning and checking in the evening before the end of the day. And in the evening, you're checking what's coming up the next day so you can see that. As part of that, I like to do with people something that's called mimetic processing, which is like a visualization exercise where we literally close our eyes and we imagine ourselves going through every part of the day. And as you're doing that, you're picturing yourself putting on the clothes, and then you're picturing yourself, for me, going into the clinic and then seeing a first patient. You can sort of see how things are going to go from one thing to the next. You prepare yourself, and then you might recognize where there's errors, where you're like, oh crap, I was thinking I have this thing at 4 o'clock, but like it's way over there, and my thing before it always takes up the whole hour. How am I going to get there in time? And so you can see those errors beforehand. So that's calendar management. It's one of the themes across these different approaches. Another would be task list management, so to-do lists. There's a whole system to do this, and usually with people I recommend having a general list that's subcategorized into different sort of spheres of life, and then having a daily to-do list. And you, as part of this, you practice prioritization skills, which for that, with people I use what's called the Eisenhower matrix. This is a matrix that I think was made popular by President Eisenhower that is organizing things based on how urgent and important they are. If it's both urgent and important, you do it today. You put it on your today to-do list. If it is important but not urgent, then you need to put it on your calendar. You need to schedule it. This is something that everyone with ADHD needs to learn, because for everyone with ADHD, there's this issue of there's all these things that I need to do, but it's not urgent, so I never do it. And so you need to develop this ability to identify those things and then put it on your calendar. And as long as you have a calendar that you're following, then you can do that. So anyways, that's task list management.
Do you have different platforms that you like people to use for tasks and to-do lists?
Yeah, I do. Usually I have a bit of a bias towards the Google workspace because usually most people have a Gmail. And so then if you have a Gmail, then you have Google Calendar, and then I like to use Google Keep. Google Keep has really good, it's good for to-do lists. People experiment with other ones, which is fine. There can be problems with integration and with, being able to update it both on your laptop and on your phone or whatever. But as long as they're able to do that, that's fine. I have some patients and clients who prefer to do things manually or keep, a physical calendar or to-do list with them, and that's fine. As long I tell them it must be portable though. You need to have it with you so that, if you are away from your office, that you can stay on top of these things. Otherwise, their papers multiply. And so everyone with ADHD will say, well, I already know these things. I've already tried this a million times, right? And I tell people it's like going to the gym. You're never done. You're never okay, now I'm fit, done with that, check that off. No, you need to, if you're going to be fit, you need to be fit every day. And it's the same thing with good executive functioning. You're going to fail. You're going to have a million calendars. You're going to make a million mistakes. But if you follow this systematically and you work with somebody, you will develop these skills, and not that long of a time. Usually with people that are working with me intensively, it's less than 2 months in order to really get this all pretty much sorted out. So yeah, those are two things. And there's other things about sort of minimizing distractions in the workplace. There's different technological supports that people can use, like reading tools. There's Swift Read, there's Bionic Reader. These are different sort of reading supports that help to hold focus while people are reading large pieces of text. There's things like binaural beats and sound machines that do have evidence. So there's many sort of non-medication tools that people can use.
I'm going to get my to-do list so I can show you. We can do show and tell because I'm very type A and, to my
Nice.
knowledge, not ADHD, and I think I take it
Yeah.
too far in the other direction. I am crazy with my calendar, and I've been doing this for years, so it's not just like a weekly phase where I'm like, oh, I'll be really organized and insane with this. It somehow
Yeah.
is maintained. But I have my Google calendars that I integrate all of them onto my Apple calendar. So I
Hmm.
have literally 8 Gmails from like school and work and other work and the podcast. And so it all has to be on one. So I have
Yep.
like my 16 integrated calendars color code. And I do what you're talking about, where it's like informal and formal commitments
Yep.
and things I might do that I want to kind of be aware of when those need to be blocked off. And
Yep.
then I have Asana, which is incredible. And this, I have every class and then work commitment color coded. And these are all the things I didn't do yesterday. But I like organize all deliverables and deadlines on there, which works really well. And then where it gets crazy is that I have my bullet journal, which I don't know if you've ever worked with anyone that does bullet journaling, but it's a whole other
Yep.
crazy side of scheduling. And I do like my weekly calendar. And then I also have my daily to-do lists.
Look at that.
So clearly
Nice.
I'm very reinforced by checking things off, but it helps to not forget things and to have
Yeah.
everything organized and on all the
Hmm.
places at all times.
Absolutely. Yeah, you anyone that's looking, you're seeing some A
It's too
plus
much.
executive functioning skills right there.
Maybe too much.
Yeah, no, I mean, well, it is something to think about, and that is I've had patients that are the other side, and I treat things other than ADHD, but people that have you don't. I'm not saying you have these things, but people do out there have obsessive compulsive personality disorder or OCD, obsessive compulsive disorder, where then there's a challenge of tolerating a bit of imperfections, a bit
Yeah.
of breaking rules and doing exposures to that. And it goes back to what we were talking about before of like this, is ADHD real, and do we just not have tolerance enough in society for sort of imperfections and inefficiency? So it's a balance, I think, for sure. But
Yeah.
those sort of systems that you have are exactly what's needed, to have good executive functioning and probably to do well on the things that are important to you.
Yeah.
So I think for people out there that have ADHD, it might seem like a huge leap to get to wherever they are now, which is probably nothing or a million like dead like zombie calendars out there
Yeah.
to getting to where you are. But I think there's a lot of intermediate steps, and for people, I had one patient who's a writer, and so he's a writer and he does some like tutoring on the side. And so he really only has like one formal commitment. Like he has 2 or 3 meetings for tutoring during the week. The rest of his time is completely open. And
Yeah.
so putting structure and actually creating a calendar in the first place was an important first step. And even with great executive functioning, his calendar, looks a lot simpler than yours does. So there's a whole sort of gradient for that people can
Yeah.
exist out there.
Yeah. I will
Mhm.
say I do give myself a lot of grace. Like I write the tasks down so I don't have to remember them, which helps a lot with mental stress and saving
Yeah.
yourself work of being like, am I supposed to be somewhere? Like I have this
Yep.
recording, like that helps. And then I'm
Hmm.
always like, well, tomorrow it'll happen at some point. But
Yeah.
I wonder if this is a piece of the puzzle as well, which is willpower. And if you've written down the things, or it's that idea of like it's important but not urgent, how do you help people get out of that kind of mental block where it doesn't need to be done, but it should be done and it could save you stress down the line? How do you kind of like bridge that gap between intention and action with regard to like
Yeah.
focus and tasks?
That's a really great question. The answer would be that it's a motivation question. So we're talking about things that are important and not urgent. And so if you don't want to do something or it's not really getting done, you need to ask yourself, is it important and or is it urgent? If it's not important and it's not urgent, but it's not important, then you need to delete it. A lot of people have these zombie to-do lists that have, these things on there that are like, read the book about the history of like human civilization. And it's like, okay, it's not urgent, and if that's not your career area, it's probably not important either. So you shouldn't be holding on to all this guilt about not doing that and it being one of 100 things that you haven't been able to check off. You need to get rid of it. So it's really important is identifying the things that are not truly important and not truly urgent and deleting them. But for the things that are important, but they're not urgent, like we said, those need to be scheduled. So, for example, for me, I did this training in early identification of cognitive decline and reversal sort of protocols for that. It was a part of my professional development that I didn't need to do per se, and it was definitely not urgent, but I wanted to, and like it was important to me. So I scheduled time each week. I made it through the modules and the testing and stuff in order to do that. So I think a lot of people have things like that. And so, if you're still struggling with something, even though you do think like, yeah, this is something I want to do for my professional development or for my own development, but I'm still procrastinating, I'd say the first thing is recognizing that procrastination is very normal in ADHD. I like to tell people that procrastination is their own self-medicating of a stimulant, which is that when you are procrastinating and you're down to the crunch, you're definitely stimulated. You're giving yourself a huge bump of norepinephrine, which is one of the components of stimulant medications, the impacts on the synapse. So you're doing self-medicating by doing that, and you'll probably see you are able to hyperfocus when you're, put in that stressful situation. So that's normal. One thing is breaking down tasks and putting early deadlines to things is very important. So, instead of I'm going to finish this 10-page paper a month from now, to instead say, okay, I'm
Mine's
going
due
to.
on Monday. I
Oh, there
only
you
have
go.
sources.
Well, that's great. That's great. So now you're going to get it. You're going to get some stimulant here, some natural stimulant coming in real quick.
Literally.
You're going to laser focus. But so for people to instead for ADHD, people need like extremely aggressive, tight deadlines. So to say like, okay, we're going to set a timer right now for 45 minutes and you're going to write the entire introduction, 45 minutes. Boom. You want to set extremely aggressive timelines, ones that maybe you won't even achieve, and that's okay, but you're trying to create this pinch for you with a bite size of the work that you need to do. And another thing is with it being a small ask of, okay, it's only the introduction. I can write that in 45 minutes. The great thing is that it was something that's known in behavioral psychology is that once you get started, it's easier to keep going. So oftentimes I'll do that with people, but then at 45 minutes, they just want to keep going and they get a lot of it done. So that's something to definitely use. But the other thing is oftentimes people, if they're procrastinating or they're not doing things that are important to them, then it's a matter of motivation. And that's something to visit with them. And so there's a thing called motivational interviewing that I do with people. And so I'll say, okay, you said that you were going to work out this last week and it was scheduled in for you to do it at 3 p.m. And looking back on your week, it doesn't look like you did it at all. So do you not want to do it? Like you could say, for example, is it really worth it to do it? Are there other things that are better uses of your time than working out? So by challenging it, instead of saying like you should be working out, we're saying, well, maybe you shouldn't be working out. What we're doing is we're giving you an opportunity to instead convince me rather than me convince you. That's what's happening in motivational interviewing. And so the person starts saying, no, like I do want to work out. I know I should. And this is something that's used in addictions as well. Well, why don't you keep drinking? Why don't you drink more? You use these sort of extreme examples. So yeah, so motivational interviewing is something that's very important in order to boost motivation once it starts to go down.
Yeah. And then you mentioned earlier that there are different techniques you can use to improve focus. Obviously, one thing is like getting started on a small piece of a task, and then it's easier to just maintain rather than motivate to do the whole thing. Are there other ways that people can help improve their focus if that's a barrier to getting these things done and sticking with a task?
Absolutely. So oftentimes people need stimulation as a part of they need more stimulation in order to focus and get things done. One way to do that is by using what I call artificial procrastination, or these tight deadlines that people can do in order to really feel the pinch and get things done. And they do that by breaking it into a smaller task. Another thing is oftentimes people find that they need higher beats per minute music. So instrumental music is less likely to cause a distraction, and having it be upbeat can make the person feel a little bit more stimulated, a little bit more active. And then we want to eliminate distractions. So like number one thing for people is to take your phone and put it either in another room or put it in a drawer, make sure notifications off, that it's silenced, things like that. Sometimes people need to either X out of all of their open windows or minimize one of those and open a new window that's only with the thing that they're working on in order to decrease those distractions, making sure that there's no notifications for, some of those common pop-ups on computers. So like iMessage or WhatsApp, things like that, that you're not having any dings on your computer as you're doing that. So those would be some of the common examples.
And then one other question for people who are listening and they want to continue to improve their executive functioning skills, continue to adjust these behaviors. Do you have any other recommendations for podcasts or books or resources where they can continue to learn about these things and kind of build their skill set around coping with and navigating ADHD in more of like a holistic way?
Absolutely. There's a number of different kind of get things done sort of books and tools and manuals out there. One is called Get Things Done. One, there's a bullet notebook that you were just mentioning. There's Atomic Habits, and there's several materials around that are out there that people use. So people can definitely experiment with those. I do find though that oftentimes people with ADHD, they need someone coaching them through this. And with ADHD, you don't necessarily need ideas. What you need is accountability and implementation. And so it's really helpful to work with somebody for that. So that's the work that I do in my clinic. My clinic is Nissen Clinic, NISSENCLINIC.com. Otherwise, there's other folks out there, either if you were just looking for a medication to try, then you would want to look for a psychiatrist. If you are looking for more of these skills, you could look for an executive functioning coach. There's several places out there where you can look for those. There is one that I recommend sometimes to people relatively new. It's called Shimmer, and they do executive function coaching. But certainly, though, if you're looking for someone to maybe prescribe and do these things, then we're kind of a small community. So that's the kind of work that I do. I would say some of the other things that could be brought up or focused with whoever you're working with is there's some dietary interventions that have a good evidence base. They have randomized controlled trials. And then there's also some supplements that I use as well, and non-stimulant medications that I use. So, some things like that, I think often paired with these lifestyle changes can create the biggest shift. I didn't mention exercise yet, but exercise is shown to be very helpful for people with ADHD. And a lot of folks have ADHD symptoms that worsen in college because they're no longer in their team sports that they were doing in high school. So that's also very common. So yeah, I would say you can kind of string together some of these resources on your own, or what I do in my clinic is I try to put them all together.
My last question is going to be if you could like wave a magic wand and give someone daily habits they were implementing that are really conducive to helping support ADHD, whether it's exercising in the morning versus at night, or making sure a certain food group is implemented every day, or being outside of the house when working, like what would those daily habits be?
First of all, waking up, I do have a bit of a bias towards exercising in the morning versus later in the day, just because as part of just if you're trying to form a habit, you want to minimize the chances for something to conflict with that habit. So doing it first thing in the day is helpful. And certainly if you're doing it as part of an ADHD regimen and you just want to make sure that it happens, then you'd want to do it first. So I would say you would wake up, you'd exercise, and then you would check your calendar and review your calendar for the day. You would do some mimetic processing, so like visualizing yourself going through the day. You would have your appointments. You would set up a good work environment that's where you minimize distractions. You have your phone with notifications off, your computer with notifications off on any messaging, and you would have a separate window for whatever you're working on. And early in the day, probably for people that are taking medications or supplements, that would be a time to do that. So one of the non-stimulant medications might be something that would come in at that point, or a supplement. Dietary wise, there's not necessarily something to add that would have a huge benefit, but usually people that are working with me that want to do a dietary approach, there'd be a form of an elimination diet in order to remove possible allergens from their diet that could be impacting their ability to focus. And it would be a lower carbohydrate diet as well to avoid some sort of like brain fog or that like 2 p.m. brain fog that you have if you have a big bowl of pasta for lunch. But then, ending the day with checking your calendar again and then, going to bed and getting good high quality sleep would definitely be part of it as well. Yeah.
Amazing. Well, if people want to continue to follow along with your work or reach out to potentially work with you, where can people find you?
Absolutely. So probably the best spot would be my clinic, which is nissenclinic.com, NISSENCLINIC.com. And then otherwise, I'm on Instagram at Dr. Nissen, dr.nissen.
Amazing. I'll put that in the show notes. And thank you again so much for joining me.
Of course. Thank you so much for having me, Sadie.
Thank you so much for listening to this week's episode of She Persisted. If you enjoyed, make sure to share with a friend or family member. It really helps out the podcast. And if you haven't already, leave a review on Apple Podcasts or Spotify. You can also make sure to follow along at She Persisted Podcast on both Instagram and TikTok, and check out all the bonus resources, content, and information on my website, shepersistedpodcast.com. Thanks for supporting, keep persisting, and I'll see you next week.